I'm Dr. Kamran R. Nejad. I'm a board-certified ophthalmologist and a fellowship-trained glaucoma and cataract surgeon here at Northwest Eye. Glaucoma is not a single entity. It's a family of diseases basically under the same umbrella and is defined by damage to the optic nerve, which usually happens over time, and high eye pressure could be one of those factors. That being said, eye pressure could be high or it could not. That's the tricky part. If the eye pressure is high, it's easier to diagnose and easier to catch up the patients. They go to a routine visit with a primary eye care provider, with an optometrist, they check the pressure, and they refer them to a glaucoma specialist. That's easier. The second group of diseases, which we call normal tension glaucoma, those are the ones which have an eye pressure like you and me, and they're just walking around, and if they just check the eye pressure without taking a look at the back of the eye, they would be missed. And they are usually present to us in more advanced stages of the disease, and it's more challenging to treat them. The majority of patients, when they become symptomatic, they notice that they are losing the visual field. They notice that they're not seeing their sides very well. If they're driving, they might have issues. Sometimes somebody is walking on their side, they don't notice it, they have to turn their head to see that patient or the object. So losing visual field is one of the main symptoms. The other thing is losing contrast. They notice that they have difficulty reading in dim light condition. They need more light. Small percentage of patients with glaucoma, which we call them acute angle closure glaucomas, pressure goes up suddenly so high that they start experiencing some symptoms. Those symptoms usually are blurry vision, experiencing halos and glare, and also pain around the eye, nausea and vomiting. These are typically emergencies and they need to be seen immediately. That being said, these fraction of the patient is a very small fraction, and the majority of the patients usually are asymptomatic initially. If anybody in the family, they have an older brother or sister, is diagnosed with glaucoma recently, at any age, they need to get checked as well. So anybody comes to me as a patient with glaucoma, I tell them, your siblings and your family needs to get tested as well, because most of the time, there is some genetic and some familial component in it. Two options that I offer to my patients initially are laser treatment and eye drops. In terms of laser, what they should expect, it's a quick procedure, it's an office procedure. It usually takes about 2 minutes to perform laser in an eye. It's not painful at all. That light basically just stimulates the cells that are in the angle of the eye and stimulates them and causes them to drain and function better. There is no damage when we look at the eye during an eye exam. Even me as a glaucoma specialist wouldn't be able to tell who had a laser procedure in the past because it doesn't cause any change. Eye drops are also another option. People who are hesitant to try laser for any reason, they could start eye drops. We have good drops that were introduced during the past 10-15 years. Depending on the medication that we choose, it could be a 1 drop at night at bedtime, or could be 2 times a day of an eye drop. And how high the pressure is basically dictates how many drops we might start initially. Patients who are not controlled with laser or on drops, and we see that they are progressing over time, and that progression basically is determined based on their exam, we need to intervene before they lose more nerve and they lose more of their vision. That basically when I talk about surgical options with the patients. We have 2 classes of surgical procedures. One of them is called the traditional, which includes trabeculectomy and the glaucoma drainage device. They have been around for many years. Trabeculectomy was probably introduced in 1960s, so more than 60 years, and is still one of the most functional. And glaucoma drainage devices. Usually these 2 are reserved for more severe conditions. Another group of procedures, we call them MIGS, or minimally invasive glaucoma surgeries. They mostly have been introduced during the past 15 years, and they are reserved for patients who have mild to moderate condition. Most of these mixed procedures are combined with cataract surgery. When we take the cataract out, At the same time, it takes a few more minutes for us to do one of those procedures and basically help the patient to have a lower eye pressure. And when it works, usually patients would be drop-free after cataract surgery, or at least it helps them to have a lower pressure with less drops. It depends on the glaucoma type. Some of them, especially the narrow angles glaucoma, which falls in the category of angle closure, we might just do a prophylactic laser procedure in the office, and that opens up the drainage and that typically cures the condition. That being said, these patients still need to be seen once a year to make sure they're not developing something else. But for the majority of the glaucomas, unfortunately, that's a lifelong condition, and they need to be seen on a regular basis depending on the severity of the condition, how controlled they are, and at the discretion of the glaucoma specialist. I believe that we have enough options to offer to our patients, and nobody should go blind from glaucoma. I make sure that my patients get the best service that they deserve. I will be with them along the way. I will be talking to them about different options, about their condition, about its stability, and I will be honest with them all the time. I treat them as family. Anything I offer to my patients would be the same thing that I would offer to my family. And I will be available for them anytime they want to ask any questions or they have any follow-up questions. I would be happy to answer that.